sons and daughters. I pray that all is well with you and your loved ones. As you know, the world is faced with a pandemic, a public health crisis of epic proportions. Novel coronavirus is a new respiratory illness that was first seen in Wuhan, China. For now, COVID-19 has put a halt on life as we know it, affecting individuals, families, institutions, and organizations worldwide, including our own. Based on information from the Centers for Disease Control and Prevention and the Imperial Medical Department, on March 16th, I canceled all meetings and events around the domain until further notice. As the leader of the ancient Egyptian Arabic order nobles of the mystic shrine of North and South America and its jurisdiction incorporated, I hope you understand that your safety and well-being are of utmost importance to me. Our lives have changed dramatically over the last few weeks as a result of COVID-19 and some alarming statistics. As of April 15th, the CDC reported more than 610,000 coronavirus cases in the United States and 26,119 deaths. The numbers continue to climb with increased testing. Medical experts say it will get worse before it gets better. With no known vaccine available for COVID-19 and other challenges facing the nation's healthcare system, it is unclear how long the so-called new normal will last. We've seen stay-at-home orders, cancellation of pro sports seasons, high school and college graduation, and the closing of churches, movie theaters, nationally known retailers, and even Broadway. This is serious. Fortunately, I believe in a God who can do anything but fail. I also believe that God helps those who help themselves. I know we all want to have normal lives, but we need to err on the side of caution for health's sake as we proceed with our daily routines during this emergency situation. If you're feeling sick, call your healthcare provider. Some symptoms of coronavirus are like those of other illnesses, but the Imperial Medical Department urges us to be aware of the following: fever over 101, coughs, difficulty breathing or shortness of breath. If you have health challenges, stay inside. Older people and those with severe chronic conditions are at a higher risk of developing serious COVID-19 illness. New data shows that the coronavirus is disproportionately affecting African Americans. For example, in Michigan, blacks account for 40% of the deaths from COVID, but they make up 14% of the population. Other states reporting similar numbers include New York, New Jersey, and Illinois. The CDC recommends the following to help keep you and others safety. Number one, listen to and follow the directions of your state and local authorities regarding coronavirus. Number two, social distancing could be effective in lowering a person's risk of exposure or of spreading the virus. It involves remaining out of congregate settings, avoiding mass gatherings, and maintaining distance from others of 6 feet when possible. Number three, wash your hands often with soap and water, at least 20 seconds, or use hand sanitizer if soap is not available. Number four, avoid touching your eyes with unwashed hands. Number five, cover your cough or sneeze with a tissue and dispose of it or cough into your own. Number six, Wipe down frequently used surfaces, countertops, tables, doorknobs, cell phones, remotes, etc. If you're okay, reach out to elderly or homebound nobles and daughters in your temples and courts. Make a phone call to make sure they're okay. Offer to run an errand if you're able. Let us pray for our nobles and daughters who are going above and beyond due to the coronavirus. Healthcare professionals, first responders, the National Guard, food service employees, postal and delivery service employees, and many others. And pray for those who have lost their jobs as a result of this crisis. Let's keep our eyes out for companies that are hiring now and share that information on our various social media outlets. This is a difficult time, but try to remain calm, pray, meditate, read or listen to some music, exercise at home, spend more time with family if you have the opportunity, or just relax. The 127th Imperial Council and the 109th Imperial Court session in Atlanta, Georgia, have not been canceled and remain on the calendar for now, pending the outcome of the current situation. The Imperial Council is working closely with the Atlanta Conventions and Visitors Bureau and local officials, and a decision will be made at a later date. Meanwhile, we're going to forego NDI donations from all temples and courts until 2021, so you will not have to make the required $500 fee this year. Those that have already submitted your $500 payment for this year will receive credit for 2021. Also, temples and courts are to issue refunds immediately for tickets sold for an event that has been postponed or canceled, even if rescheduled. A prayer call will be held on Monday the 20th at 8 p.m. Eastern Standard Time. It will be hosted by Imperial Chaplain Ricky Lee of Arabia Temple number 12. The dial-in number is 508-924-5009. Again, let's be vigilant when it comes to our health and safety. I have no doubt that by the grace of God, we will get through this. As I receive information affecting our membership, I will promptly relay it throughout the domain. For the latest facts and figures on the coronavirus, go to the CDC's website, www.cdc.gov. God bless you.